It is a huge honor today to be interviewing my online buddy, Fly Fishing Doc, who's been on Dental Town for a long time with over 1,000 posts. And when we started this interview, his wife walked by, Kathy, and so I told Kathy to stay on because I would love to just start with this this amazing piece of data and see what you guys run with it. Dentists have had the highest suicide rate several times in the last 30 years. But if you look at the numbers, it's male dentists. It's almost never female dentists. And they always talk about in divorce that, a third of it is from financial, a third of it is from infidelity, and a third of it is substance abuse. And women dentists, 30% of women dentists marry a dentist in their class, which is what you two did, which is why I told you to stop and pull up a chair for the intro question. And the other 70% of the female dentists, if they don't marry a male dentist in their class, they marry someone kind of like a dentist, maybe a lawyer, physician, a banker. But the bottom line is they have a job.
They make choices, these women dentists.
Yeah, and a lot of male dentists, they go out and marry the cutest thing they can find at the bar, and they'll never have a job, and they'll destroy $10,000 a month for the whole relationship. It's about $4 million. They talk about graduating $250,000 in student loans, and I'm like, dude, you just married someone who's going to destroy $4 million before you die, and that's a big part of pain and suffering, and which an environment that leads to dysfunctional behavior, burnout, disease, depression. So I want to ask you, Kathy, when did you guys meet in dental school? When did you start dating? Did any of your other classmates marry a female? And you guys work together. What is it like working together and then going home and being husband and wives?
That's a lot of questions there. I'll start at the beginning. We did meet in dental school the first year. I was a Brown. He was a Bickel. We're alphabetically arranged, so we were near each other. So we were dating other people at the time. I sat next to another Brown. Come to find out, he was quite the jokester in our class. Started a rumor about a month into school that we were engaged. Everyone in our class was coming around, oh, congratulations, what an amazing love story. You just met and already you're engaged? What is that like? And we're both wondering, what are you talking about? So it came around that this guy sitting next to me started this whole rumor. Little did we know, 3.5 years later, we would be dating and getting engaged.
Yep.
Well, congratulations. How long have you been married now?
It'll be 23 years. I'm sorry, 22 years. I'm in trouble now. It'll be 22 years on August 21st.
So you dated all through dental school and married after graduation?
We started dating junior year of dental school, and we got married at the end of our residency. Okay,
and so that'll be another question, but later. But so you guys, did you immediately start practicing together?
No, that was our goal from the start, to get a practice together. But we went our own ways at first as associates and got some experience till we were ready to purchase our own practice.
Yeah, we worked as associates for about 6 years before we purchased our practice.
And do you guys work in the dental office at the same time, or do you do different times to have more hours covered for the consumer, or do you overlap the whole time?
We overlap the whole time.
So you drive to work with each other, you drive home with each other, you live with each other, you work with each other, and you've been doing it for how long? You've been working together?
17 years.
Okay, so what I want to hit you, because I think the dentist's personal relationship with his wife is far more important than his practice. What advice? You've been doing this for 17 years, and there's 2 kids out there, 2 little love bunnies that are just starting it out. What advice, 17 years of a man and wife dentist working living together, would you give the young kids who just walked out of dental school and are opening up day one? You've made it 17 years. What advice would you give this young couple so they can still be married 17 years? And because, a lot of times the wife dentist, when she's working with her husband, she's thinking, well, I've had no prior convictions. I have no legal history. If I shoot him right now, I'll be out on 7 years in good behavior. They'll sentence me for 20 and I'll be out in 7. What advice would you give these couples about working together since you've done it successfully?
Well, I would say we didn't always do it successfully. There were some bumps in the road at the beginning because I'm very much into technology and doing new things, and so I worked 4 days a week full time. Kathy's 2 days a week, and so what would happen is we would start doing something and she'd just be getting used to the new way that I was doing something, and I would jump onto something new and say, oh, I just bought this material for the office and this, and we're going to do it this way now. And it was kind of annoying for her. So,
it was a bit frustrating.
Yeah, so I had to kind of scale that back a little bit and understand that she wasn't working as much as I was, and so the things that I was getting quicker because I was doing it twice as much, that I had to kind of slow things down and not buy so much new stuff to drive my wife crazy.
And what was your perspective? What advice would you give the young couple on that specific?
On that, so one thing that we did that really helped us out a lot, I think we separated our interests somewhat. So we're in the
Yes.
same dental office. I'm more interested in some aspects of dentistry. And
Which
Matt,
ones?
I'm interested more in kids, orthodontics. I treat some babies for tongue and lip tie, and that interests me. Matt's more of the big restorative, endo, implants, that aspect of it.
Yeah.
Yeah, I want to ask a question to a female dentist that I can't really ask or answer because I'd be written off as a sexist, but do you think since women have maternal instincts, they're more geared for pedo and children? Because in all honesty, there's 9 specialties. If you told me I had to be a pediatric dentist, I'd hand you my license. If they said, oh, no, you have to, or we're going to take away your citizenship and you're going to have to find another country, glad. I'm going to Sydney or Toronto, first plane out. I mean, I just can't do it. I mean, when a kid is crying, my resting pulse is 140, my head starts sweating, and there's no money in China to do a pulpotomy. I mean, I still have to do it. But do you think it's sexist for a man like me to say, well, you're a woman, you have maternal instinct, so you're probably better with children? Should I just not say that, or is it just me? Or
I think that's true much of the time. Not all the time. There's exceptions to everything, but I think much of the time that is true.
And you know what? I think pediatric dentists, the future of pediatric dentists is going to really change, because pediatric dentists used to make bank when all the dentists were males. But now that 45% of the graduating class is females, I mean, almost every female dental student dentist I know, almost every one of them likes working on kids. And over every man I know that's my age, that's the last thing they ever want to do.
Yeah, it takes a special amount of patience, and you're
Yes,
not
it does.
expecting to do great amounts of dentistry at one time.
Okay, so then I got another question for a couple, because there's young kids out there starting this. Now, do you guys both defer to an office manager, or is one of you the office manager and one of you kind of acts more like an associate, or how do you handle staff? And also, how is it confusing staff? Like, if Matt tells me no, and I just turn around and say, I'm waiting for Kathy. You know, I'll just go ask Kathy. Kathy will say yeah. Or if Kathy's being all, no, we're not going to do that. Well, she's only 2 days a week. I'll wait till she's gone. Then I'm running to Matt. How do you handle that, or do you not see that issue?
We handle that like parents.
Yeah.
We have to be on the same team.
Exactly. That's how we've always been with our daughters, is that if one of us says no, then the answer is no. Unless the two of us get together and talk about it and change our mind, but never go against the other one when it comes to dealing with your staff or dealing with your kids if you're talking about family.
Mm-hmm.
So how many kids you have?
Two
And
daughters.
they're both girls?
Yep.
What are their ages?
One is about to turn 15 and the other one just turned 20.
Yeah, see, the difference between me and you, I have 4 boys, so I only have to worry about 4 boys. You have to worry about every boy in the entire state of New Jersey.
Yes. I'm well armed.
You're well armed.
That's right.
So what other issues? And I don't even know what the question would be, because I'm not married to a woman dentist. I don't work with a woman dentist. I mean, what other issues am I not even smart enough to ask that you've conquered in 17 years that you could be giving advice to a young couple, man and wife dentists that are now going to work together?
Mm-hmm. You want to be on the same page financially.
Yes.
That's very important. You have to have the same goals, the same ideas about what to do with your money, how responsible with your money you want to be, where you want to put it. That's important.
Yeah.
A lot of complaints come over what to do with your money.
Yeah.
Okay, well, go be more specific. So you're talking about investing savings, or not spending, or not buying a $150,000 CAD cam or $150,000 CBCT or $75,000 laser. Are you talking about those issues, or are you talking about we have $5,000 this month to put away, or it's going to be in a 401k or an index fund, or are you talking about the more specifics? Because finance bottom line, finances, 1/3 of divorce.
Yeah.
I mean, 1/3 of divorce is over money and 1/3 over sex. And if you start paying money for sex, it's even worse. if you mix those. So be more specific.
Pretty much, I would say it's. I don't know if we can be more specific because it's pretty much anything that we'd want to do with our money, but a lot of it has boiled down to expenditures in the office. And one of the things that I would say to a guy married to another dentist where they have a practice is that oftentimes your wife picks up on things that you don't when it comes to financial issues or equipment purchases or advertising. I've learned in 17 years that if Kathy has a bad vibe about something and says don't do it, that it's probably not a good idea.
Kathy, would you say that one of the big problems with boys is boys are just, they measure themselves by their toys, and they're always the first to run out and buy some big old gadget. Do you think that's a problem with boys and toys more than women?
That's been my experience anyway.
Yes.
Yeah, that's what I see too.
More likely to buy some big toy than I am.
No, I'll give you more specific. Like if I go into a woman dentist office who places implants, she has one system. I go into a boy office that places implants, he has 5 systems, and he bought a $150,000 CBCT. And the woman has one system, and she sends her patient over to the periodontist to get a CBCT for free. I mean, boys just like toys. And you agree with that?
Yes, women, like, at least for myself, I like to find a way to do it, keep consistent, do it the same way. It feels comfortable. I'm not ready for the next and the next and the next all the time. Matt, what's newest on the horizon? What's coming out? What's the newest, version of that? What's the newest toy? Let's get it in. Let's buy something else. And
so now every woman listener on this podcast wants to know, how do you train a male dentist? You use shock therapy, you use violence, you hit him, kick him, drug his food. What do you do?
Point out how it didn't work out well in the past.
You have one of those steel trap memories where you can point out every damn example he's ever made wrong in 17 years?
Yep.
Right on. So Matt, is that why you're called Fly Fishing Doc on Dental Town? Because she takes all your money and prudently puts it away, and you're only left with a fishing pole and a worm?
No.
Hey, fishing stuff can be very expensive.
Yes, my fishing stuff can be quite expensive. Yes, but it's it's funny when I'm out fishing, I oftentimes not only forget what I do for a living, but oftentimes forget my name. I'm so engrossed in it. So it's a very good mental break from all the things that we do in the office.
Now, does she go fishing with you, or is that your man time solo hobby?
A little bit of both. A little bit of
both.
She does go fishing with me sometimes, but a lot of times I'm doing it by myself. One of my favorite things to do is to go striped bass fishing in the middle of the night, and Kathy's not up with kayaking on the bay.
On my feet in the middle of the night.
Yeah.
Is that ocean or freshwater? Is that rivers, lakes?
That's ocean in the bay. I usually take my kayak out at about midnight until 3 o'clock in the morning, and so it's a nice diversion. There's usually no other anything out there but me.
And what bay? What city are you talking about?
I'm talking about near Ocean City or Longport.
You're not going to give details.
I'm not getting. No, that spot is classified.
Well, I have to tell you, I have the fishing disease too. I grew up actually, not kidding. You could almost throw a rock from my front door into the Arkansas River. So I went channel catfishing, just nonstop my whole childhood. And now I've gotten into ocean fishing. We go to Cabo, and I just love
nice.
it. I mean, I think it's funny when people say, "Oh yeah, I want to go catch a marlin." Dude, I've been on trips that I've caught 18 on one week. You know what I mean? I mean, I love it. There's something about no cell phone, no internet, no computer, no, just out in the middle of nowhere catching these fish, and I just love it.
Yeah.
So, Kathy, you got that bug too?
I do not have the bug for the ocean. Seasick. I like my feet on the land. So my favorite is the small trout streams, like in North Jersey, that kind of thing, in the mountains.
So do you guys utilize an office manager?
We do not.
No.
We like to keep it as small as we can.
Yeah.
So how many operatories? How many employees? What's it look like in there?
We have 3 operatories. We have a full-time front desk. We have a full-time dental assistant, a part-time dental assistant, and a full-time hygienist.
Okay, so this is what the receptionists tell me. You know, and I've talked to a gazillion on this. They say, you know, it's horrible because the wife comes in and says go right, the wife dentist, and then the man dentist comes in and says left, and I just want to sit here and cry or pull my hair out. So how and you're talking to younger dentists, or you might be talking to a marriage that's in trouble.
Yeah.
Talk to an office manager right now, because you guys seem functional and happy. And I can tell your body language is smiling, giggling. You guys are in love and all that stuff. Talk to this office manager or these man and wife dentists. What is she supposed to do? I mean, you both are her boss.
Yeah.
You're telling her 2 opposing things on so many issues, and they do. They tell me they don't know where they should cry, pull their hair out, or quit. So what would you say to everyone? What would you say to the man and wife dentist and the office manager?
They should absolutely talk to the office manager
Yes.
together.
Yes.
The 3 of them hear the same conversation. That's really important.
I'm sure you've seen on my post that I'm taking the Dental Maverick course with Tuan Pham, and one of the most important things that we learned in that course is communication and consistency. And your staff is not going to function well unless you communicate with each other, you communicate with your staff, and that you're consistent in what you're doing. And a husband and wife dentist that's pulling their office staff in 2 different directions is their practice is going to suffer because the patients are not going to see consistency, and their staff is going to show that they're very stressed out because they're not experiencing consistency from the husband and the wife.
Okay, so Matt, you guys have been doing this for nearly 20 years. You've almost been on this earth half a century. Address the real. What's that?
Thanks for reminding me of that. My daughter reminded me of that too. Next year, Mom, the big 5-0. Thanks.
Well, the bottom line that no one wants to talk about is the fact that we're a social animal, and social animals are programmed that if we all don't get along, we're not going to survive. And if the group of humans or monkeys or apes or dogs or cats or horses go 2 different directions, the coyotes and the hyenas and the lions and so we're hardwired to not communicate. We're hardwired that when someone says okay, we just say okay, and we're thinking all these thoughts. So how do you coach a dentist to communicate when their natural birth hardwiring as a social pack animal is not to tell you how I feel? How do you communicate? I guess, and one of my favorite definitions of success is how many uncomfortable conversations you're willing to have. Because I swear to God, if the house is on fire, they're going to say, well, how was your weekend?
Yeah.
You know, like, the house is on fire. Why do you care about my weekend? So how do you have uncomfortable conversations? What have you learned that you didn't really know 20 years ago? To have them with your assistant, receptionist, your spouse, everyone. How do you address something that humans don't want to talk about?
Well, it's funny that you should put it that way, because one of the things that's in the Dental Maverick course is to retrain your brain and to think differently about those situations, that instead of looking at it as being an uncomfortable conversation or something that is a confrontation, that you look at it as a way for people to better understand what you're trying to do and to resolve a problem. So you turn that negative into a positive, and if you're having trouble, say, communicating with your spouse, and you're constantly having arguments about things, then if you can address that and change it, as uncomfortable as that conversation might be, it actually is going to make your life better, because it gives you the opportunity to resolve that issue and not have that problem anymore. And it's the same thing with your staff. If you're constantly having an issue, then ignoring it or talking about something else or just sweeping it under the rug doesn't actually change your situation. That conflict is going to come up again and again and again. So what you need to do is look at it from the other way around, that if you can get through that uncomfortable conversation, change things for the better, then you'll stop having that issue, and then it's actually a positive instead of a negative.
Kathy, I want you to answer this, because you're the woman dentist. A lot of times when I'm at a dinner party or whatever, and there's a couple like you, and there's 3 or 4 single guys, I mean, their wives don't work, somebody will sit there and say, God, I wish my wife, brought home 10 grand a month. I mean, what would you, not have, wanting to have uncomfortable conversations, what advice would you give to a dentist who kind of resents that? It started off, you were a stay-home mom, and we had a couple kids. We had 2 daughters. But come on, the girls graduated from college. You still don't have a job. And I'm sitting there busting my butt doing a root canal for $1,000. And every time I come home, you bought a $1,000 purse. And why did you buy a $1,000 Gucci purse when I had to do a molar root canal for that? And I had to do it 3 times because I had to do it twice to pay the rent, mortgage, equipment bill, that computer, insurance, malpractice, and only the 3rd one got you your damn purse. How would you coach a male dentist to have a conversation with their non-working spouse if you think, since 1/3 of marriages will fail over money?
Well, that's a tough one. They have to be together on the finances. I think that, again, is important. I think the male dentist has to appreciate what his wife is doing. One of the most important things they're going to do in life is raise their children, take care of their home. That's so important. That's one of the reasons why I work part-time my whole career practically. So I wanted to be able to do both of those things. I'm not the buy a big expensive Gucci purse kind of person, so I can't really relate to that. I kind of think it's irresponsible to spend a lot of money like that. But the finances are both of theirs. Yeah. And you have to look at that way. You can't look at, the guy can't look at it as, this is all my money that I earned. It's not. That's a bad way to look at it. It's the family's money. It's the husband and wife's money together. Yeah. Whoever actually earned it doesn't matter. It's theirs together. And if you split hairs like that, I earned this money, you're looking for trouble, and you're going to get resentment from your wife and vice versa.
Yeah. I'm getting resentment from you that you said split hairs when I don't have I don't have any hair. She's sitting there all 5 pounds of hair telling me to split my hairs. So then I want to ask you another. I'm just going to keep going because you're so damn good. A lot of dentists are at your age right now. You said your girls are 10 and 15 or 10 and 16?
15 and 20.
Okay, 15, 20. So a lot of dentists are thinking this. A lot of them have resentment. They're saying, well, I put myself through school. I graduated $250,000 in student loans, and now I'm a rich dentist. And the wife says, well, we're not doing that. We're paying for the kids' school and all that stuff. And they're gonna graduate with no debt. So, but that's a big finance issue. So, So did you guys? So my question to you first is, did your mom and dads put you through dental school? Did you graduate no student loans?
No.
So you're both.
We both had loans for a long time, very long time. Yeah. Refinanced those loans, extended those loans.
Yeah. Okay, so then the question is, you got a 20-year-old. I'm sorry to throw you under a bridge right now. Now you got a 20-year-old. So is she going to do that too, just like mom and dad did, or are you paying for her college?
Yes and yes.
We're paying for her college, but she's also working to pay for her rent and her spending money. And she's a very independent and industrious girl. She works very hard. She's in culinary school, and she works as a waitress at a restaurant, and she's always doing something, whether it's working, school. She's very.
So you paid for tuition, but she pays for rent and spending money.
Yeah, pretty much. I mean, we pay for tuition. We give her a little bit more, but she's one of these kids where she's very proud of herself when she says, "Hey, I made enough this month that I'm paying the rent myself. And I'm also paying this bill," and so it's I'm very impressed with her for that.
Well, that's awesome. So what other advice would you give a married couple working together? How do you now when you're driving home from work? So when you work the 2 days together, so you work 2 days by yourself, and you work 2 days together.
Correct.
So then, in reality, when you're driving home, is there a point where you just turn off dentistry and turn on your 2 daughters and family, or does it really blend? Is it really amorphous, or does you really know? Is it?
It blends like crazy. Our girls laugh when we talk at the dinner table about dentistry. They just kind of roll their eyes.
Or when we're out and we say, "Hey, how are you? Who was that, Mom? Who was that? Dad? One of our patients."
Yeah,
really
whatever.
Again?
Yeah,
okay.
they used to go, "Oh, another one of your patients, huh?" And they'd say, "Listen, those people are the reason why you have a roof over your head and you have nice things. So be happy that we're running into patients all over town."
So does any of them get the dental bug?
No. Our oldest daughter, who's in culinary school, has she cannot stomach anything blood, medical, anything like that. That's not her thing. And the younger one actually wants to be a sign language interpreter.
Wow.
So
You tell your daughter in culinary school that I want to see the first recipe that includes 4 fresh wisdom teeth.
Oh.
I mean, come on, there's ham and bones. There's a ham bone in my ham and beans. Why can't there be 4 molars in a chili or something?
Yeah.
We'll call it Kansas chili or something like that. Then I want to ask you another question. So a lot of couples are coming out of school and they're saying, come on, man, Kathy, you graduated 20 years ago in 92. Those were easy days. You didn't have corporate dentistry. You came out when the getting was good. But me and my husband, we're coming out and, the sky's falling. What would you say to that? Do you believe that, or do you think that's all in their head?
I don't believe that at all. I think that we are in.
We heard the same thing.
Yeah, we heard the same thing when we were in school.
The old doc said, the golden age of dentistry when I first came out of school, and it's no longer that way.
And they're working on a decay vaccine. The caries vaccine is going to be out in 5 years, and we're all going to be out of a job. Yada yada yada. And what I see as being one of the great things about dentistry now is that so many people are keeping their teeth for so much longer that we've got adult orthodontics that Kathy's doing. We've got implants that I'm doing. We've got a lot of root canals. There's so many new things that we can do. I mean, there is virtually nothing except for a cleaning that we are doing identical to what we learned in school. I mean, we're doing laser cavity preparations. We're doing laser gum surgery. I'm placing implants, which, they were in their infancy when I was in school. Digital radiography, I mean, we take that for granted, and that wasn't even thought of when we were in school.
The cleaning's not even the same.
Yeah, the cleaning's not even the same.
We weren't allowed to use the Cavitron.
Yeah, and now we've got piezo's and all that kind of stuff, and and the other thing about dentistry is just that one of the things that I was thinking of as I was preparing for this is that as human beings we tend to want to have more. And some people look at dentistry as, I'm going to make $300,000 a year, or I'm going to make all this money and everything, and you probably won't make that much. But if you look at the statistics in our country, the median household income, not median individual income, but the median household income in our country is about $51,000 a year. As a dentist, you can work 4 days a week, 30 hours a week, and you can easily double that, most of the time triple that, without even really working all that hard at it. You can be an associate working in somebody else's office and do more than double what the median household income is. So sometimes I think we as dentists need to stop, take a deep breath, and say, wow, we have a really sweet gig, and not to complain so much about it. But yeah, there's so much technology coming out now, and there's so many different ways to do things that I see this as another golden age of dentistry, because there's so many things that we as GPs can do.
Well, you said golden age. I think it's kind of gone from the golden age to the titanium age, because what I'm excited most about titanium dental implants is that, when someone loses their tooth and you file down the 2 adjacent teeth and do a bridge, you haven't changed any of their behavior. They're still eating 150 pounds of sugar. They still don't brush, floss, see the dentist.
Yeah.
And that now 6-7 years later, now we're missing 3 teeth.
Right.
And so you decided to place titanium. What I love about titanium is, I feel like dentistry for 100 years goes out in the middle of the farm and builds a wooden barn and then tells you to brush it and floss and use Listerine and a ton scraper. And then 7 years later, the termites have eaten the whole barn, and you always blame it on the farmer. Right. And now we have a chance to go in there and build an aluminum barn, and without brushing or flossing or anything, you come back 7 years later and termites can't eat it. So I want to ask you, how did you get into implants? Did you take a hands-on course? What implant system specifically did you buy? Did you have to go out and buy a $150,000 CBCT and do surgical guides, or do you freehand it like a real surgeon, or what? Talk about that.
Okay. Well, I had been wanting to get into implants for quite some time and was looking for a way to do it. And one of the reps from Hyasin stopped into my office and said they were offering a course and would I be interested in it? And I was absolutely interested in it. So I took the hands-on Hyasin course at their
Spell Hyasin for our viewers.
It's Hiossen. It is it's a Korean company, and their U.S. headquarters are very close to here in King of Prussia, Pennsylvania. And so I took the hands-on course there and placed my first implant with them. And I find that the system is very easy to use.
You did the hands-on course in King of Prussia, New Jersey?
Yeah, King of Prussia, Pennsylvania.
King of Prussia, Pennsylvania. And was that on humans or cadavers or mannequins or?
It was a progression of mannequins to pig jaws, then to people.
And then was the first live patient your mother-in-law or did you?
That would not have been wise.
No, actually, the first.
Isn't that the main benefit of getting married? Is you have your mother-in-law to do all your experimental dentistry on? I thought I read that on Wikipedia somewhere.
Yeah.
I might need a citation source for that.
Yeah. No, actually, my first implant was placed on a woman who's been a long-term patient of the practice, and she had been wanting to get an implant done, but just didn't have the money for it. So I basically did almost the entire thing for free, so that I could get some experience with my first one, and then it's just. It's just been progressing from there. I'm still not doing as many as I'd like to, but I'm doing a fair amount. And I would say that the vast majority of the ones that I do are free-handed. I do sometimes make surgical stents here in the office with just some aluminum tubing that get from Home Depot, and just center it on there and use a suck down, and then it gives you a guide for your initial osteotomy. I have done one guided surgery that I did with Cadre, and
Armin.
Yes.
Did you take Armin's course?
No, I did not. But I practically got Armin's course with all the Facebook messages we had going back and forth. But
The problem with Armin's course, it's amazing information, but he's much more funnier online. But in real person, he's just a quiet, shy guy. I was expecting a stand-up comedian. I thought I was going to meet Louis C.K. or something, and he was just this shy, normal guy. And I'm like, my God, I mean, because he is so hilarious online. His comments, it's like British dry humor or something.
Yeah.
It works the camera, huh?
Yep. But I have really been enjoying placing the implants, and I have to say just thank you to you for Dentaltown, because that's one of the other things that my daughters laugh about is that this is how you usually see me. Yeah.
On the Dentaltown app?
Put that down, Dad.
Actually, I had the app for a while, and I was running out of room on my phone, so I got rid of the app, and I just go onto the mobile site, and but I have learned so much through Dentaltown. I just finished a really difficult implant case that I think it was the second extraction that I did in preparation for doing implants. It was a college girl who had an over-retained primary tooth that she lost, and I put Bioplant in, which I, shortly after putting it in, doing the research and everything online, it looks like great stuff. I find out on Dentaltown it's not great stuff. And through the research that I was able to do on Dentaltown, I learned what I needed to do to get rid of it. I was private messaging with Holden several times about it, and was able to get that out of there, get a proper bone graft in, rebuild the whole ridge, and I just placed her scrumentation crown this week, and the case is all finished. And if it wasn't for Dentaltown, that would have been sent to the periodontist with my tail between my legs. Hey, I put the wrong stuff in. Please bail me out.
Well, we can all thank Al Gore for Dentaltown. Well, so more specifics. How much did the Hyasin kit cost? How much was the training course? How much was Armin's course? Did you recommend Armin's course? And the most important question, did you end up buying a $150,000 CBCT?
Oh, those are all good questions. Let's see.
I don't see Kathy holding a knife over your head, so I'm not. I think you didn't have to buy the
No CBT.
The Hyason course in and of itself was about $3,500, but they credit it back to you if you buy an instrument kit and a credit with them for implants. So I spent about, I'd say, 30, maybe 35,000 on the course, the equipment, the instruments, and then a credit of implants that I still have credit on. And then I did not take Armin's course, but I would love to, just from the experience I had working with him on that one guided case that we planned out. And as far as what we were talking about earlier about guys being gadget oriented, we have a small office, like we said, 3 operatories. We do not have room for a CBCT, but I did have some guys come in giving me a presentation on one, and I was looking for where I could knock down a wall to be able to fit one in.
But so do you have access to a CBCT? I mean, if you need one, is there? I mean, like how big is your town? Is your town Turnersville? Is that a suburb or is that just the town?
It's a suburb. It's part of Washington Township, which is also the township that we live in. We live in a different section of town.
So do you have access to like a radiology center that has a CBCT, or do you just not need them?
We have access to two places where we can get them. The orthodontist, who's a couple doors down in our complex, has one, and he does them for free for us if we need them. And there's also a mobile service called Mobile Facial Imaging that is local around here, where they will bring a truck to your house, your place of business, wherever, and they'll do a mobile cone beam.
So which one do you use mostly?
I'd say about 50-50. I've done a couple with the orthodontist, and I've done maybe 3 with the.
And what makes you pick the orthodontist or the mobile? Is it the type of machine? Is it do you just don't want to bother the orthodontist since it's free, or what makes you decide which one?
What usually makes me decide which one is I try not to bother the orthodontist because I don't like feeling like I'm imposing on people. But sometimes we have, something comes up where I look at a case and go, you know what, I think I really need a cone beam on this one, and if I have to send them to the mobile, then we're going to need to reschedule them. So usually they go to the orthodontist when it's a.
Do you think if the orthodontist charged you $50 and had some skin in the game, that you'd feel less guilt and more likely to do it? Is this your religious upbringing that's making you feel guilty?
Right. You know what? What he told me is that when the patient comes in, if he can get paid by their medical insurance, he'll get paid by their medical insurance. If not, he just eats the cost to be nice. So I don't know. It just he's also has a very busy office, and sometimes he just can't fit them in. So I try not to impose on his.
Now, Kathy, did you not get into implants because you just never really into blood and guts, or did you not get into implants because you see this mechanically and say, okay, well, if he's going to get into that, I'm not going to duplicate all the training and all that because I'll just let him do that. And you said you were doing what, 6-month smiles, or what did you say you're doing?
Yeah, power procs, 6-month braces, yeah. So
and Kathy also does comprehensive as well.
Comprehensive what?
She also does comprehensive ortho, full, 2 or 3 year bands and brackets, the whole.
But did you split that up over interest, like, braces is clean and cosmetic and you're just not a blood and guts person, or did you do it like business, like, well, it'd be more efficient just to invest money in you to do this, and then I'll invest money to do this, so we don't have to duplicate the cost of all the training?
More like that, yeah. It's not that I'm avoiding blood and guts or anything like that. I really enjoy orthodontics, which surprised me. And the big restorative is not as much my interest, so it made sense for us to split that way. You get the training, you take this part of the practice, I get the training, and I take this part of the practice. So
what else do you guys separate? You do ortho, he does implants. What else do you separate?
Not much else.
I do basically all the root canals.
Yeah.
Also, I do retreats of root canals as well, which kind of flows in nicely with the implants because then if I'm managing a retreat and I notice that there's a fracture or it doesn't seem like it's something I'm going to get a good result out of, then we talk about doing an implant. And orthodontics, when we first bought the practice, we bought the practice from a dentist who was he was starting to mainly specialize in orthodontics and TMJ. He was getting out of the regular restorative and he was moving out of state. And so he had a lot of orthodontic cases that were going here. And he was a former faculty for which group was it? American Orthodontic Society. So he came in and did basically a private in-office course for us so that we could take over his patients. And as we progressed with this, it was something that it really didn't interest me all that much. And I found myself every time I saw an orthodontic patient on the schedule, I thought, oh, it's a waste of my time. I'd really rather be doing such and such. And we started to get to the point with, us both doing the same thing, that it seemed like that it was unnecessary that we were doing the same treatment, and it would be better if we branched out and I could be expert in one area and she could be expert in another area. And it also, I think it lends itself to a better relationship with patients. They view it a little bit differently when I'm doing a new patient exam and the patient tells me that they're interested in doing some orthodontics, and I tell them, well, my wife does all the orthodontics in the office because she has all the training in that, and she does the same thing with implants when somebody wants to replace a missing tooth. Well, let me have my husband come in and take a look at you, and it has more of an air of expertise and extra training when I can't do it but she can, or she can't do it but I can. I think the patients look at it a little bit differently then.
It was better for us too. Less competition.
Yeah.
So what other high price areas did you go CAD CAM?
No, we have not gone CAD CAM. Our main office expenditure for technology is 2 Waterlase machines. We actually just
two of them,
and we just had our new I+ 2.0 installed today, and we also we have another I+, the regular one, and that's being upgraded to the 2.0 system.
The 2.0 Waterlase.
Correct.
And how much did that cost you?
We got a very good deal.
Should probably not disclose.
Yeah, I don't. Deal. They probably don't want us to disclose the good deal because we've been customers of Biolase since 2004. And so when they're
but for a listener, I mean, there's AMD lasers for $2,000. There's some lasers for $50,000 or so. What would it retail at?
Yeah, you're talking around the $50,000 to $60,000 mark.
And why would you need 2 of them instead of 1?
Basically,
I want one too. We have a his and hers.
Yeah,
seriously,
for
you have a his and hers Waterlase laser.
Hold on. Here, the new one is right here. It was just installed today, and this is what our tech put on it.
You know what? Seriously, you have to send me a picture of you two with his and hers Waterlase, because I think you might be the only. There's 2 million dentists on Earth. You might be the only married couple dentist with a his and her Waterlase on the entire Earth. You might be 2 out of 2 million. Yeah. Will you send me that?
Sure, I'll be happy to.
And I missed my opportunity to get the pink one. Our tech did not show me the pink one until today.
Oh my God!
I was ensured that it was a hers.
Yeah.
Oh, I'd send it back. I would send it back just for the photo. No, I think that would be absolutely hilarious to send out. You have a rockin' hot dental office and a rockin' hot marriage when you buy his and her lasers.
Well, what was happening was when we first got into laser dentistry, what was happening was we had trouble scheduling people on the days that we were both here because we basically went all in with them, and we use them for restorative, we use them for crown troughing, I use them to lay flaps for implants, I use them for root canals. About the only thing we don't use them for is cleanings and ortho. And even sometimes ortho, you need them to get extra tissue out of the way or to do a little gingivectomy.
Okay,
So,
but in all honesty, someone that's going to spend $50,000 on a laser, let alone $100 for his and her, go slow down a little bit. Why you bought that? Go slow down a little procedure.
okay.
Because this person's 85% of my listeners are on an hour commute to work. And
Right.
so they're driving to work, and that's why we always get a transcript of our podcast because you log on down, so they don't have to pull over and do notes. But slow down and spend a little more time because $50,000 that's a huge purchase.
It is. It is.
I mean, on $50,000 that's a lot of money. So you could buy a car for that. So
Right.
why did you buy a $50,000 laser? What procedures and why? What are you doing with it?
Well, the main reason why we got involved with it was because we wanted to do no anesthesia restorative, which I would say for virgin teeth or replacing a composite, probably 70% of the time you can do it with no anesthesia.
And for the kids, almost 100%. No primary teeth that I've
Yeah.
encountered need anesthesia with the Waterlase.
Okay, and how does that work?
I wish I knew. I don't think the BioLase people know
Yeah.
it has an anesthetic effect.
So explain how you numb up a primary tooth with a Waterlase.
You just start cutting and the kid feels nothing. What's
So
absolutely
you're not like holding it onto the tooth and making a
No.
numbing deal.
No,
You're just cutting with it and they're not feeling it.
right. You're using
So that is it numbing the tooth or just cutting it without them feeling it?
Just cutting it without them feeling it.
But
So
it-
they don't get that numb feeling, which is fantastic for the kids because
Yeah.
a lot of times, even if they get past the needle stage, the fact that they're numb really wigs them out.
Yeah.
And they don't like that and they get upset. So if we can do it without a needle, without the numb feeling.
But are these mostly occlusals, preventative resin restorations, or are these DOs and MOs?
These are class 2s, DOs, MOs, occlusals, and the laser also, not only is it can you cut the cavity prep without them feeling it, but also it does have an analgesic effect to it where if there's a spot that you're having trouble reaching with the laser, you can go in with a slow speed round burr and they don't feel anything. What amazes me the most with the kids is you'll do this whole prep and think, I hope, they say they're comfortable, I hope they are, and then you go to put the matrix band on it, and that's the only time that they wiggle is when that matrix band goes around the tooth. And when that happens, you know for sure that you've had a kid that's been comfortable throughout the whole procedure.
Because the matrix band's hitting the tissue.
Yeah, because they're feeling a little tightness from the matrix band.
So how long would it take you on a first molar? How long would it take you to prep an MOD with a high speed versus an MOD with a Waterlase laser from BioLase?
I would say it might take, I don't know, as far as cutting time, I'm going to say it's a little bit longer, maybe, between checking the prep and depending on how big it is, maybe 10 minutes of prep time, or it might be 5 minutes with.
Okay, so you're basically bought his and hers lasers because you're doing no anesthetic, restorative, operative.
That's how it started out. But what happened was once we got them in our hands, we started to realize there was so much more that could be done with it.
Now these are carbon dioxide lasers?
No, these are
erbium YAGs.
These are
erbium.
YSGG.
Is that an erbium YAG or just erbium?
It's erbium. It's erbium YSGG. I think it's Ipsilum, selenium, garnet. I don't remember all the letters, but it's erbium YSGG.
YSGG.
Correct.
Okay. And so you started out investing $50,000 because I would think that'd be a huge marketing word of mouth referral thing. If people are leaving your office and Kathy just did a filling, I didn't get a shot.
Yeah.
That'd be huge. Are you using it on your marketing, or do you do much marketing, or do you market yourself as a laser dentist? Or
yes, that's the name of our practice is the Dayspring Center for Laser Dentistry.
Right on. And you think that's a unique selling proposition? That's a good.
It is,
Absolutely.
and it not only, I mean, even for things that we don't use the laser for, it has kind of a halo effect that people, people look at the equipment that we have and they say, okay, you guys are on top of the latest things. And we hear a lot of times from people when they come in, oh, my old dentist wasn't like this. He's back in the Stone Ages.
Unless they're in Colorado, then they're just stoned.
Yeah.
So you started off with doing no anesthesia restorative dentistry. What % of your restorative dentistry is done with a erbium YAG or an erbium YSGG laser from Biolase and not giving anesthetic?
And not giving anesthetic, I would say maybe 40%, because we do a lot of amalgam replacements. So most of the time with an amalgam replacement, because the laser can't cut the silver, you do have to numb and remove it with the high speed. Although if somebody has a smaller amalgam with a lot of decay around it, oftentimes what I can do is I can go around the amalgam very carefully with the laser so I don't hit it at all, and then you basically take the high speed and it's got the analgesia effect, and you can cut the silver in half, you can cut the amalgam in half with the high speed, and then pop both halves out and then just go straight to the laser. I don't do that very often, but you do have some patients that are very, very needle phobic, and they say, hey, I'm okay if I feel a little bit because I'd rather do it that way than get.
So you would say 40% is needle free?
I would say so.
And do you use amalgam? Do you place amalgam or are you amalgam?
No, we've been amalgam free for 16 years now.
Okay, and then, so what other procedures do you do with that laser?
Pretty much everything.
Perio.
We do periotherapy with it. We do frenectomies with it. I use it for extractions like a periotome. I'll trough around the tooth and start cutting the ligament attachment with the laser. I lay flaps for my implants with it. I do implant recovery with it. We've also done some treatment of failing implants with it with some good results. And I also, one of my favorite uses for it is root canals, because what the laser will do is it'll set up it's kind of like an ultrasonic in the sodium hypo, and gets it circulating, and you get a lot more debris coming out with the sodium hypochlorite than you do with just squirting it down the canal.
So you put the bleach, the sodium hypochlorite in there, and then activate it with the laser?
Right. You put the sodium hypo in the chamber, put the laser tip in the chamber, and activate it. And it's almost like putting stone on a model trimmer. It starts bubbling, and you see it kind of circulating around, and then you'll see little pieces of debris coming out. And
Penetrates the walls.
Now, is this the laser used for LANAP?
No, it is not. No, it is not.
By the way, when I'm asked these questions, remember, I'm trying to guesstimate the
Right.
7,000 dentists. So don't you go home tonight and say, did Howard have a head injury?
No.
I'm just trying to sit there and think, okay, there's 7,000 people. They're all alone. My whole motto with Dental Town is that we could use the internet so that nobody would have to be alone. You know what I mean?
That's the great thing about
so many dentists go home and all their loved ones don't know if this laser is used for LANAP. You know what I mean? So I try to form a community. So is this the laser used for LANAP?
No, it is not. That's the Periolase that's used for LANAP. But
and who sells Periolase? Because that kind of sounds like Biolase.
I believe that's Millennium Technologies, if I remember correctly.
And did you think about getting a Periolase by Millennium for LANAP, or do you use the Erbium YSGG for perio? We
use the Erbium for perio, and we get pretty good results with it.
You think it's kind of similar, or do you think it's like a knockoff, or are they both? Is one the name, one generic, or what do you think?
I think Periolase has they have a patent on the procedure, and their wavelength is specifically for doing the LANAP. Basically, what we do with the Waterlase is very similar to LANAP. You're cleaning out the diseased tissue in the pocket, you're sterilizing the pocket, and then you're treating the root surface of the tooth to give a better surface for for the attachment to reattach to. And I mean, basically anything that you're doing to clean off that root surface, get the bacteria out of the pocket, and give the patient a clear shot to keep everything clean is going to provide you a good benefit. One of the
So if someone came in and they had a bleeding 6mm pocket, when you went in, you would take the laser in there?
Yes.
And would you also try to just like physically remove 2 or 3 millimeters of that tissue just so it has access? Or are you talking about you would take laser and then just kind of to use it to kill bugs, anaerobic bacteria?
You would use it to remove some of the excess tissue, and also basically to make a large trough in the gums. And then with I have 6X loops, and with the 6X loops in the light, once I make that trough, I can actually see down the root surface, and it kind of the same visibility that you would get doing a flap surgery without having to lay the actual flap.
Okay, but on that bleeding 6mm pocket, if you're going to reduce that to like a 3 and clean it out, would you numb it up for that, or is that?
Yes, that you would have to be numb for. Most of the soft tissue procedures, unless they're minor things like I treated an aphthous ulcer on Kathy today, and something like that you don't need to be numb for. Crown troughing you don't need to be numb for, but anything more involved in that, like a frenectomy or any kind of perio treatment, you would need to be numb for, because there's a lot more tissue that's removed.
And does she usually get a canker sore after her day off, where she's just day drinking all day long? Would you say that's what it is? You know, she's just day drinking. Does the day after day drinking usually get her a canker sore?
Ever since I've known her in the pressure of dental school, dental school was like an aphthous factory for her.
So, Kathy, you think canker sores are related to stress, or do you think it's food and pH?
I think they're related to stress.
You think it's a stress response? Because some people think it's acidic foods, like they'll say, I always get it after tomato sauce or grapefruit juice or orange juice. Some people relate to citrus, but you think it's more an autoimmune response to stress?
For me, it is. I don't get bothered by the acidic things, but the stress, I had 2 really large ones in dental school, the biggest of my life, that they came in and said, oh, can we photograph that? And that was the most stressful time of my life.
Was it around finals or boards, or you don't want to say?
Yeah, it was near the end. I think it was when we were trying to get the requirements done.
So talk to our listeners about what happens to the canker sore. So it's sensitive, it burns when you eat or drink, and then he does what with the laser, and what's it afterwards? Mm. And do you need anesthetic for that?
I did not need anesthetic for that. It's on very low power, 0.25 watts, so it's very low power, no water.
And is he cauterizing it, or?
Yeah,
that's basically it. Yeah,
so that it heals faster.
Yeah, you're basically, I want to say, the laser term would be ablating, but kind of frying or cauterizing that top layer where all the virus particles are living, and you get rid of that. And what usually happens, because I've had it done to me as well, is it'll get a little bit hard and almost scab up within like the first couple of days, and I'd say it reduces the amount of healing time by about half, but it's also much more comfortable for that time that it's healing, because it's more like you jump to the last 3 days of the aphthous instead of having to go through the whole thing.
So what would you say to a dentist who's out there thinking, I've been looking at that Waterlase, for years, but 50,000, that's huge. What would you say to that person? Do you think it's a return on investment, or is this part of Matt's boy toys?
It is. I think it is if you're committed to it.
Yeah.
We've heard many people get the Waterlase. There's a learning curve involved. If you're not willing to put the time into the learning curve, then you're going to put it in the corner, and you're going to be upset with yourself for spending $50,000 on this ornament in the corner.
It would be kind of akin to somebody getting a CEREC machine, and they do a couple of crown preps and they get an open margin and go, I'm just going to take impressions and send it to the lab. Mm-hmm. It's something that you have to work at to perfect it, to get it to work well for you.
But it's worth it.
And would you say that's the most common toy that you guys had in common? That was of a expensive piece of equipment that you guys both agreed on and play with evenly? I mean, obviously you bought his and hers.
I would say the two things that we spent the most money on and that we enjoy the most together would be the two Waterlases and the two Jeeps.
The two Jeeps. What kind of Jeeps did you get?
She has a Grand Cherokee and I have a Wrangler.
And do you guys like Jeeps because you like your camping, fishing, kayaking, or what?
Yeah, we like to play outside.
Are you're both outdoor people?
Yeah.
Huh,
Yep.
that is awesome. Well, hey, do you think we're out of time? Do you think you guys would ever do a online CE course on the his and hers Waterlase? I still think you're probably the only two man and wife married dentists on earth that have his and hers Waterlase. This has got to be the rarest story I've heard in at least a year. I don't think it exists.
Oh, yeah, we're special. What can I say?
You are special. I really think you are special.
I would. Yeah, I'd be interested in doing something like that. We actually joked around with the Waterlase techs a few years ago because the older machines were much more temperamental, and I developed a whole protocol for how to care for the machine and the tips so that we wouldn't have problems with it. And I always joked with our tech that I should teach a course on how to.
Well, you know you should because the bottom line is, I know dentists as well as anything. I mean, the only thing I might know better than dentists is my four boys, and dentists believe dentists. So it doesn't matter what a dental manufacturer says. The dentist is always thinking, well, you're just trying to sell me your bonding agent or your glue or whatever. Yeah. But you guys are honest, have integrity, married 17 years, 2 kids. You bought your own money, his and her deal. They would listen to you 100 times more than a dental company. And so I think if you did one, because really, why did a man and wife dentist each buy a his and hers, specific laser? That's a huge story. And you guys should share that story. But hey, we are completely out of time. I just want to sit here and say that. Huge fan of your post. Love your website. I just think you're a great guy. I'm a huge fan of your posts. And I actually did this podcast just out of selfishness. I wanted to meet you online. I wanted to go to lunch with you. And I'm in Phoenix, and you're a 5-hour plane flight away. And this was just so rocking hot cool for me. And then to the viewers, Kathy just happened to be walking by 1 split second before we started. I'm like, hey, grab her, because I wanted to meet you too. So thank you so much for spending an hour with me. Good luck on those 2 girls, and we'll see you later.
Thanks, Howard. Take care. It was a blast.
All right. Bye-bye. Thanks again.
Bye.